I'm Laurie, I'm the principal dentist here along with Esme. We built and own this 4-surgery dental clinic. I specialise in providing comprehensive dentistry, which includes anxious patient management, implant dentistry, oral surgery, sedation and full mouth rehabilitations. What I really enjoy about dentistry is the variety. I love the fact that each day I'm doing something different, but with a common goal, making a difference in people's lives and allowing them to do the things that they want to do. A dental implant is the closest thing we have to a natural tooth, so we often call it a like-for-like replacement. It consists of 3 parts, so you've got the implant screw, the abutment and the crown, and what that does is it replicates the root of the tooth, provides a crown for you to chew and eat on, but also aesthetically fills a gap, so it's a great option. So during an implant placement, in essence what we're doing is we're gently raising the gum, drilling into the bone to create enough space for our implant to go. We now use very cool techniques that allow us to be much less invasive. And once we're happy with everything, we normally take an x-ray just to check the position and everything. Accuracy is very important for us, so we do everything guided, and that's a surgical guide that is pre-planned before your visit. Once we've closed the implant site, we just put in a few little stitches and allow everything to heal gently. Those stitches stay in for 2 weeks, and after 2 weeks we get you back, we remove the stitches, we check on the healing. Once we place the implant, there's a number of ways you'll leave on that visit. Sometimes if it's a back tooth, we may just put a healing cap on and we just allow the gum to heal naturally, or sometimes we're actually giving you a same-day crown. This is a temporary crown, but it will allow the gum to mature around it, and it also fills the gap. So that's a really nice technique, which is cutting edge in implant dentistry, that allows you to leave the same day with a tooth in the gap. A lot of people don't quite understand the impact of losing a tooth. When we lose a tooth, it affects the rest of the mouth. What will happen is the 2 teeth either side of the gap will fall inwards. The tooth that opposes the missing tooth will drop downwards or rise upwards, and ultimately it makes it harder to clean and brush your teeth. The next thing is the effect on the bite. When you lose a tooth, other teeth are overloaded. This can lead to cracking and breaking of the neighbouring teeth, which can result in crowns and root canals and other teeth being removed. We here at Thornbury Dental Wellness Clinic like to take a comprehensive approach where we're thinking, okay, if we lose a tooth, how can we replace the missing tooth to make sure that we don't get these knock-on effects? Planning implants digitally, without getting too technical here, involves 2 things. One is the intraoral scanner, and that basically captures a picture of your teeth and creates a 3D model. We then take a CT scan. A CT scan is a 3D x-ray, which shows the bones, the width of the bone and the height of the bone. And we mesh those 2 together. We can wax up the tooth and then we can plan your implant digitally. So what makes us different to a lot of dental clinics? There's very basic things that we do that I don't think a lot of clinics are doing. Things like how we manage anxious patients, that we offer dental sedation, that ultimately will make sure that it's a really positive experience. But also we're using the latest digital technology in terms of scanning and CTs, being able to have that kind of advanced implant care under one roof. If I was a patient, that's a fantastic place to go have my implant treatment. If you're thinking about implant treatment and you're just a bit stuck and you don't know where to go with it, first step is a consultation. So you can either give us a call, you can give us an email, or you can just reach out on the website. One of our friendly team will be in touch. The implant consultation will give you a bit more information about what an implant is, whether you're suitable, and exactly what's involved.